students, welcome back. In this session we are going to see the capsule and the ligaments of the temporomandibular joint. Okay, here as we know that this is a synovial joint. Each synovial joint is covered by a joint capsule, and this joint is reinforced by other ligaments called as specific to that joint ligaments. Okay, here the elasticity of the joint capsule, here you can see this is the joint capsule which is present somewhat deep here. Okay, so the elasticity of the joint capsule and ligaments are responsible for the available motion in the temporomandibular joint in all planes. Okay, the motion can be enhanced or restricted depending upon the flexibility of this capsule and the ligaments. Capsule is also called as capsular ligament because it is giving support to the joint, whereas this capsule is also attaching the two bony parts, so it is called as a capsular ligament here. Okay, the portion of the capsule, so here you can see, so this one is another ligament, this is temporomandibular ligament. So below this you can see these fibers are the capsule. The capsule is surrounding the capsule is surrounding the temporomandibular joint, and it is attaching the neck of the mandibular condyle. It is attaching the neck of the mandibular condyle superiorly, that is inferiorly it is attached to the neck of the mandibular condyle. Superiorly it is attached to the articular tubercle anteriorly, and the squamotympanic fissure posteriorly. So behind this posterior glenoid tubercle you will have the tympanic plate, and also a fissure is present in between the tympanic plate and the posterior glenoid tubercle, that is called as squamotympanic fissure. So it is attached to squamotympanic fissure posteriorly, and the circumference of the glenoid fossa medially and laterally. Okay, this is the attachment of the capsule. We'll see again. Inferiorly the capsule is attached to the neck of the mandibular condyle. Superiorly it is attached to the articular eminence anteriorly, and posteriorly, that one also superiorly, in the superior posterior aspect it is attached to the squamotympanic fissure, and also it is attached to the circumference of the glenoid fossa laterally as well as medially. This is the attachment of the capsule. And the capsule and disc is also attached to one another anteriorly and posteriorly. Okay, that one you know. Now coming to the this capsule, we have seen that because of this attachments, so it is having more attachment on the superior aspect, anteriorly only at the articular eminence, and inferiorly to the neck of the mandibular condyle. Okay, so the portion of the capsule superior to the disc, is quite lax, whereas the portion of the capsule inferior to the disc is tight. Okay, so the disc is more firmly attached to the condyle below and free in the superior aspect, free to move on the articular eminence above. So, and also the capsule is thin and loose in its anterior aspect. On the anterior aspect, the capsule is thin and loose, but and the lateral aspect, on the lateral aspect, not only on the anterior aspect it is thin, but also on the medial side and the posterior side. Medial side, so this is the lateral view, so medial side means on that side. So on anterior, medial and the posterior side, this capsule is thin and loose, whereas on the lateral aspect, so it is very much stronger. The fibers which are present on the lateral aspect of the capsule or with long fibers which is connecting with the temporal bone and the mandible. Okay, that to condyle. So if you see this thing, because of these attachments and all, so the most weakest part in the temporomandibular joint regarding capsule is the anterior aspect. So the lack of strength of the capsule anteriorly, and also so anterior side only will have that incongruency, isn't it? So both this articular eminence as well as the anterior part of the mandibular condyle. So because of this incongruency and weak capsule on the anterior aspect predisposes the anterior dislocation of the mandibular condyle takes place. Anterior dislocation of the mandibular condyle takes place. So that means anterior dislocation of TM joint is occurred because of this weak capsule and incongruence of this articular surfaces. So commonly, which is the site of dislocation, common site of dislocation in temporomandibular joint means anterior dislocation. Okay. Now the capsule is highly vascularized and innervated. So the entire capsule is highly vascularized and innervated, and so because of this vascularization and innervation, it provides or it gives a lot of information about the position and movement of the temporomandibular joint. Because of its innervation, it sends always impulses about the position and the movement of the temporomandibular joint. Okay, so this is about the capsule of the temporomandibular joint. Next, coming to the ligaments. So the primary ligaments of the temporomandibular joint are the temporomandibular ligament. Here you can see temporomandibular ligament. The name itself indicating that it is attaching the temporal bone to the mandible. Okay, so this is the one of the strongest ligament. And the next ligament or the stylomandibular ligament. Another ligament is the stylomandibular ligament. And next another ligament is this ligament is an accessory ligament which is the spinomandibular ligament. So the names itself indicating that from where to where it is attaching. From sphenoid bone to the mandible, this ligament is attached, that to the inner surface of the inner surface of the ramus of the mandible, this ligament is attached. Now we are going to see one by one. So now the first ligament and the major ligament is the temporomandibular ligament. This temporal mandibular ligament is the strongest ligament, and temporomandibular ligament is composed of two parts. It composed of two parts. The outer oblique portion. So now we are seeing is the outer oblique portion and inner horizontal portion, oblique portion and horizontal portion. So the outer oblique portion attaches to the neck of the condyle and to the articular tubercle Here you'll have the neck of the condyle and to the articular tubercle. So it serves as, what is the function of this oblique portion means? It serves as a suspensory ligament. It serves as suspensory ligaments and limits the downward motion and posterior motion, downwards and the posterior motion of the mandible. Okay, so again we will see. So temporomandibular ligament is one of the strongest ligament and it is composed of two parts. One is the oblique portion and another one is the outer oblique portion and inner horizontal portion. So this outer portion attaches to the neck of the condyle and to the articular eminence or articular tubercle of the temporal bone. It serves as a suspensory ligament and limits the downward and posterior motion of the mandible as well as a rotation of the condyle during opening of mouth. So this is the function of the oblique portion of the temporomandibular ligament. So the main function is it serves as a suspensory ligament when the mandible is moving downward as well as posterior, and it limits the rotation of the mandibular condyle during opening of mouth. Okay, the inner portion, now coming to the inner portion of the ligament. So this inner portion of the ligament is attached to the lateral pole of the condyle. We know that. So it is having medial and lateral poles. The medial pole is somewhat extended medial. So here the inner portion is extending from the lateral pole of the condyle and to the posterior portion of the disc. So over it we will have the disc, isn't it? So condyle. So it is extending to the posterior portion of the disc and to the articular tubercle, and it is attached to the articular tubercle. Then its fibers are almost horizontal. And this will resist the posterior motion of the condyle. This will resist the posterior portion of the condyle. So this is called this is about the inner portion of the temporomandibular joint. So because of this limitation of the posterior condyle rotation, so and finally it also protects the retrodiscal pad. So we know that the disc is having a retrodiscal pad on its posterior side attachment, isn't it? So that inferior laminae is attached to the neck of the condyle. So this horizontal portion which is limiting the condyle on which is limiting the posterior motion of the condyle, so that it will not rotate more posteriorly. If it is not allowing or limiting this rotation, it will put some pressure on the retrodiscal pad. So that thing is not happening because of this horizontal portion of the temporomandibular ligament. Okay, so neither of these bands, that means oblique portion as well as the horizontal portions, limits the forward translation. These fibers will not limit the forward translation of the condyle or disc, but they limit the lateral displacement, because this ligament is supporting on the lateral aspect of the joint. So this ligament is supporting on the lateral side of the joint, and that means this ligament is limiting the lateral displacement of the joint. So this is about the temporomandibular ligament. So we'll see again, the temporomandibular ligament is a strong ligament and composed of two parts. One is the oblique part and another one is the horizontal portion. Oblique portion of the temporomandibular joint attaches the neck of the condyle to the articular tubercle, whereas and it serves as a suspensory ligament and limits downward and posterior motion of the mandible as well as the rotation of the condyle during opening of the mouth. Whereas the inner portion is attached to the lateral pole of the condyle, and also attached to the posterior portion of the disc and to the articular tubercle. So its fibers are almost horizontal and they resist the posterior motion of the condyle. So if you see everything, posterior motion of the condyle, that means it serves to protect the retrodiscal pad also. So if you see all these things, this ligament is limiting the rotation of the condyle. Okay, rotation of the condyle as well as the posterior rotation of the condyle only. So it mainly gives or limits the rotation of the mandibular condyle on the articular disc. So it doesn't have any it doesn't have any function, or it doesn't limit the anterior translation of the condyle. Only this ligament is limiting the rotation of the condyle. In the translation of the condyle, this ligament doesn't have any function, but they limit the lateral displacement of the condyle. So this is about the